Yes, health na wealth like dem dey take talk. That is person wey get health, e don get everything. Because no matter wetin you get, if health no stable, like say person no get anything. That is why we calm down. Put this so for ground wey we call am health matter. Health is koko, is very germane because we have to look say wetin dey do me for body, wetin dey happen for my body on time. Early detection nko e dey help to cure a lot of things. That is why we get we own certified doctor in the building, man wey sabi as far as health dey concerned. I dey talk about no other person but our doctor, Dr. Bat. How you dey, sir?
Thank you very much.
Good morning, sir.
Good morning, sir.
How are the patients doing?
So pleased to be with you this morning.
Pleased to be with you too.
Doctor,
Slimmest of them all.
Good morning.
Good morning.
Good morning, sir. How was your night?
It went well. And yours?
Very well.
Hope it was restful.
Yeah.
At least.
Rest but this is our work.
I mean,
Work now.
then I still rest. Now be this anyway. So.
Okay. Good morning, viewers at home and around the world. My name is Dr. Bartholomew Tochukwu Febunam. I'm the medical director of Grace Valley Medical Center. This morning we'll be looking at the topic we started last week. It's a topic that is very common in this environment. It's no other topic than typhoid fever, also known as enteric fever.
Enteric fever.
We're going to look at the introduction. We'll look at the causes. We'll look at the clinical findings, signs and symptoms if you like. We'll look at the diagnosis. We'll look at the pathogenesis, as well as prevention and treatment. Okay? As a word of introduction, typhoid fever is a life-threatening infection usually caused by bacteria. The name of the bacterium that causes typhoid fever is known as the name of the bacteria that causes typhoid fever is known as
hemorrhagic.
No.
That's like the common word.
Plasmodium.
Yeah.
It's not plasmodium. When you talk about plasmodium, you talk about malaria. Okay, so it's caused by Salmonella. It sounds very.
I think I won't forget again.
Very,
I go link
it
up
sounds like
I can't just speak it, but I know I remember that thing.
Okay, so it's called Salmonella Typhi. There are also a similar disease that looks almost like typhoid in presentation that is known as paratyphoid or paratyphoid fever. Now, it's caused by some strains that are referred to as paratyphi A, B, and C. Usually, the paratyphi A is the commonest. The paratype B is second to that, but C is usually not very common. Talking about paratyphoid fever, they do not cause the same severity of disease like Salmonella typhi. How do we get this bacterium? Salmonella typhi can be transmitted through contamination of fecal matter. When we talk about fecal matter, we're talking about stools. Can be transmitted through contamination of fecal matter, stool. Not just fecal matter, as well as urine, okay, from individuals, from human beings. I also want to say at this point that that human beings are the only host of Salmonella typhi, meaning that unlike some other diseases that we've talked about in this program that have something to do with maybe from a rodent or from a mosquito, this one is basically human is the only carrier that we have. Talking about carrier, there are also some percentage of people who may pick up this infection. About 1 in 300 people who may pick up this infection, it will show initially some mild symptoms in them and nothing other than that. And afterwards, they will remain carriers, meaning that they will have this bacteria in their guts, in their intestine, usually in the small intestine. The part of the intestine that it usually has a predilection for is referred to as Peyer's patches. Okay. Now, we have all these bacteria in our guts, in our small intestine. When I mention gut, I'm also talking about intestine. Okay. Now we have it in our guts. Usually from there, they get into the Peyer's patches, which is a form of lymphoid tissue or a lymphoid nodule. From there, they undergo multiplication over time and then get into the bloodstream and can go as far as getting into some other various organs of the body, talking about the liver, the spleen, as well as sometimes the kidneys. Now, how do we get this bacteria into our system? When you eat something that is contaminated with this type of bacterium, what happens is that when these pathogens are ingested in form of food or drink that may have been contaminated by stools, fecal matters, they get into our body, get into the GIT, get into the small intestine, headed straight to the lymphoid tissue when they undergo multiplication, and then get into the bloodstream. By the time it gets into the bloodstream, that's about the time it starts manifesting symptoms. And what are the symptoms that we can see in typhoid fever? There are a number of them. I'm sure most of the symptoms are things that we know in this environment.
Okay.
Talk about symptoms like headache, fever. Fever and headache are said to be the most prominent symptoms when you talk about typhoid fever. Okay. In about 75% of cases, people who have typhoid will present with fever, usually in the first week of presentation. Now, if it is untreated, the symptoms usually will range from early symptoms to late symptoms. In an untreated person, you could have about 4 stages. The first week is the first stage in which you have the initial symptoms. It could be flu-like symptoms. In some cases, you may not have any symptoms at all. Now, these symptoms usually, the type of fever you have there is what we refer to as step-ladder type of fever, in the sense that increases in the step-ladder approach. It could be off and on, but it keeps increasing, climbing up over time. Also, one could have severe headache at the initial time. Person could also have joint pains, weakness, malaise. These are symptoms that you can find in any other acute febrile condition. Yes, like malaria in this environment. So these are symptoms you can find in some other diseases in this environment. So it's usually difficult to distinguish this set of symptoms at the initial stage. Now, by the time you get to second week, you have fever that may have shot up as high as 40 degrees centigrade or 104 degrees Fahrenheit. Okay, at this stage, there may be other symptoms which could include GI symptoms like nausea, vomiting. In children, you may have diarrhea. It's usually commoner in children.
Really?
Diarrhea.
What about in adults?
In adults, you could also have diarrhea, but more commonly found in adults is constipation. Now, I also want to talk about
constipation. Are you serious?
Could make you faint, Abby.
No,
constipation talks about constipation is actually when one is not able to open the bowel or go to toilet for some period of days.
What do you make a person faint?
Indigestion. Doctor, so which one is convulsion?
Convulsion.
But which one is indigestion?
No, indigestion has to do with when we eat food and we discover that over some period of time, the food is expected to have gone beyond some certain location in the GI.
But we're mistaking that for constipation.
No, that's not constipation. It has to do with your food not digesting as at when it should. Okay, so it has to do with the transit time. Okay. Now,
sorry, doctor. Say that one where food no digest. Say person no be talk say maybe because he never did warm. Now he cause am. You know say this part of the world.
You don't drink plenty water.
Or you know say this part of the world we know they the warm. When last the warm?
If I won't lie, years ago.
The warming actually is another kettle of fish entirely, but it doesn't have anything to do with this. Okay. So, but sometimes people who have peptic ulcer disease and gastroesophageal disease may have challenges with indigestion. Okay, but that's not our focus for today. Now, because of how we have viewed typhoid in this environment, it will be nice for me to actually point a number of differences that exist between this disease entity with malaria. Number one is that I want to say that this disease is not as common as malaria.
It's not as common as malaria.
Now, going by the figures we have from WHO, in 2017, for instance, there were about 219 million cases of malaria in 87 countries of the world. that caused about 435,000 deaths over a period of 1 year. Now, in typhoid fever, going by the WHO fact sheet, 11 to 20 million people are said to be affected annually. We talked about malaria, 219 million people in one particular year. But for typhoid, 11 to 20 million said to be affected annually, causing about 128,000, between 128,000 to 161,000 deaths annually. Now, in industrialized countries of the world, like America, they may have as low as, sometimes they may have as low as 400 cases of typhoid in one whole year. In UK, they have about 500 cases of typhoid in 1 year.
Wow.
Okay, but in our environment, I also want to point out that, yes,
Just
typhoid
500.
is common in our environment, but it is not as common as it is in Southeast Asian countries. For example, typhoid is said to be very high in places like India, Pakistan, and some other countries around there, even Egypt. Okay, now these are places where you have about 100 cases or more in 100,000 population. Okay, but in our own environment, we have in the neighborhood of 10 to 100 cases, over 100,000 in the population. So it's not as common
we
as
still better past those.
It's not about being better, but I'm driving at something, because the way manner we have regarded typhoid in this environment is that usually you see people walking into the clinic, walking into the hospitals, coming to the lab to ask them that I want to do tests for malaria and typhoid. So it's not as common as we have made it to be. Now, because of this, it has led to the problem of overdiagnosis, because oftentimes on the strength of wider tests alone, a lot of people will take to treatment even without a doctor's prescription. They may be treating a disease that they may not have at that time. And by so doing, we give rise to development of resistance to some of the drugs that are currently being used. Before now, a good number of us usually know a particular drug. Years back, amoxicillin is regarded as typhoid drugs. But over time, it's no longer effective because of the problem of resistance.
Everybody go to do for
now, this problem of multi-drug resistance, as well as the emergence of HIV pandemic, have actually changed the spectrum of this disease. Has actually changed the spectrum of this disease. Okay, so you should learn not to make a self-diagnosis of typhoid. If your basis of making the diagnosis is just wider tests alone, you're going to hear more about that in the course of this presentation. Okay, so let's continue with where we left it up in terms of signs and symptoms.
Dr. Ba, before we go signs and symptoms, I beg, here's something where they bother me for
please
my
go ahead.
ask you. Say chronic typhoid, if it take for body, where person no treat and where. Say if it resort to kidney failure.
Liver.
Kidney failure.
Okay, kidney.
Ben, kidney failure.
Thank you very much. Number one, I want to, usually we don't use it. The term chronic typhoid is actually not used in the sense that the incubation period for typhoid is usually between 7 to 14 days. Okay. In some situations, it could be as early as 3 days. It could last as long as 30 days. In few cases, it could go beyond that. Now, usually within this period, okay, we have the first week set of symptoms, we have the second week set of symptoms, we have the third week set of symptoms. That is in an untreated patient, someone who has typhoid and did not go for treatment. Okay, so we start seeing complications that are associated with this disease usually in the third week. Okay, you have things like myocarditis when it affects the heart muscles. It affects the kidney as well. It can cause encephalitis. It can cause typhoid toxemia, or it can show some neuropsychiatric symptoms. I think you asked that question.
Yes, high fever. Yes,
that when somebody will start becoming disoriented, delirious, while the person is having fever. Okay, so that can happen. That can occur in typhoid fever. The same presentation can also occur in cerebral malaria. Okay, but you can actually differentiate which is which by just conducting some laboratory investigation to actually pinpoint what the person have. Now, in typhoid psychosis, for instance, you usually have what we refer to as motoring delirium, okay, or coma vigil. I will explain.
Now, before you explain, let's quickly take, make we open our phone line so that the people wait there at home, they go fit ask anything where they bug them, where they do their mind in yaga as far as health they concern. Doctor dey here gidigba, gbangba to take any question where you ask. Oh yeah, let us go, sir.
So now I stopped at thank you very much.
Lifestyle delirium and coastal
motoring delirium, okay, and coma vigil. Now coma
and vigil.
When person
coma and then come do overnight.
Now coma vigil is actually some of the presentation that we can see in people who are manifesting typhoid psychosis. Usually they lie down, their eyes are wide open, and you probably think they're seeing you, but they're in a state of coma. So that's why
that's you do like this.
Yes,
nothing
happens.
So that's what coma vigil is all about. So this can happen in typhoid. Okay. Now, so if we have people who are presenting with these symptoms, we need to properly evaluate them, not just to consider that these are psychiatric illnesses. Such a person should be referred to neuropsychiatric hospitals. Yes, but a number of things will be need to there will be need to rule out a number of possibilities that it could be. Okay, now let's talk about the diagnosis of typhoid. It is important we do so. Most of the time in this environment, our diagnosis of typhoid is based on wider tests. Now, wider test is a test that has lasted over 100 years. Okay, in 1896 was actually when wider test came out, so to say, okay, and it was named after the person that invented it. Okay, now the name of the person is Georges Fernand Wider. Georges Fernand Wider. And ever since then, it became a diagnostic tool for making the diagnosis of typhoid. But over time, there were a number of other discoveries of better investigation tools that they realized we have Mustafa from FCT.
Mustafa, good morning. Good morning, sir.
Good morning.
How are you doing?
I did fine, sir.
Okay, our doctor dey here.
Good morning, sir.
Good morning, my brother. How are you today?
I'm fine, thank you, sir.
Yeah, thank you very much.
I wanted to ask a question from the doctor.
Okay. Please go ahead.
Go ahead.
Good morning, sir.
Good morning, my brother.
I wanted to find out that if somebody is weak down, is it from typhoid or fever?
Somebody is what?
Weak.
Weak?
I'm weak, yes.
So you're asking if it's from typhoid or fever?
I wanted to know whether it's from typhoid or fever.
Okay, doctor.
Thank you very much, Mr. Mustafa. Yes, weakness can be found in a number of disease entities in our environment. Commonest things they say occur commonly. Okay, if you're weak, I think you should be thinking of, yes, typhoid can cause weakness. Okay, malaria too can cause weakness in this environment, but those two can actually not be taken in isolation. When we were mentioning, or when we mentioned the symptoms of typhoid, we said that we pointed out that usually it is indistinguishable from symptoms that could be presenting, or someone who has malaria can present with. Okay, the symptoms could be indistinguishable. Okay, but what will enable us to actually know what exactly this person has is diagnosis. Okay. And this should be done in a hospital setup. Okay, so that's where we are at this moment. So if you're weak, you will need a doctor to evaluate and make a diagnosis and know exactly what you have. Okay. Thank you very much for that question. Okay, so talking about diagnosis, in this environment, over time, what we have come to know as the test for typhoid is wider. And I will tell you the reasons why the test is no longer as relevant as it used to be today. Okay, number one is that among the tests, the number of tests that one can actually do to determine if one has typhoid is the least sensitive.
The wider test.
The wider test. Okay. Now, what are the most sensitive tests that one can do to determine who has typhoid and who does not have? Wider is just a serological test. Okay, but
is it just a particular test? Because for me, I used to think wider covers every test, from malaria to every other thing.
Usually in this environment, it's for malaria. But you will hear the. I'm going to talk about how it links up with malaria. Okay, so you can see the picture we have. So in the order of the tests that can be done to make a clinch the diagnosis of typhoid fever, number one, that is said to be the gold standard.
Gold standard.
Yes. Is to do a bone marrow culture in the first week.
Which we think is expensive.
Not only is it expensive, it's an invasive procedure. It will require piercing a part of our body or bone to actually pick out. Okay, but in places where the expertise exists and where people can afford it, it is the gold standard. You can get a yield as good as 90% in the first week. Okay, now next to that is blood. You can do a blood culture. Usually we'll stay for some few days, 2 to 3 days, to be able to know if one has typhoid or not.
Sorry to cut you, sir. In the process of having the blood culture, while it is still in the lab and every other thing, is it possible or is it advisable for one to start receiving treatment at that point?
Thank you very much for that very intelligent question. Now, because these cultures will take days, like I pointed out a while ago, you will need a doctor to make a clinical evaluation. You need a doctor to make, usually in the hospital setting, when a patient comes to the hospital, a doctor does what we refer to as clerking.
Okay.
You take history from those patients. You look at the patient age, what the patient is coming in with, the complaints. Usually we'll have chief complaints and some other ones. And after that, you do what we refer to as general physical examination, and then you examine the systems of this individual. At the end of all of this, the doctor will have a diagnosis.
Okay.
Usually we'll call that provisional diagnosis. And you also have differentials. If it is not this, what other things can it be?
Possible option.
Now, on the strength of this, on the basis of this, the doctor will order for lab investigations. Okay, if the doctor is thinking this person has typhoid, okay, usually that's why I said a medical evaluation is required. Okay, now there are a number of things that can make typhoid to stand out. Okay, number one is that the fever, depending if the presentation is within the second week, the fever is usually very high.
Okay.
Hyperpyresia, temperature of 40 degrees centigrade, equivalent to 104 degrees Fahrenheit. Okay, and when you have temperature, it's usually most of the time, if somebody is having temperature, you discover that the person's pulse will be high. Talking about the heartbeat. Okay, but in typhoid, you have this high fever. We have Matthew from Jalingo.
Good morning, Matthew.
Good morning, all.
How are you doing, sir?
Very fine.
Our doctor is here.
My question is this. After the treatment of typhoid fever and malaria, what causes running temperature?
That's after the treatment.
Thank you very much.
After the treatment of typhoid and malaria, then one has a running temperature. What are the causes?
Thank you very much, sir. Now, if I got you right, what you're trying to ask is, after undergoing treatment for typhoid and malaria, and one still has temperature, what could be the cause? Now, if that is the question, number one, there could be a relapse. Number two, there could be a treatment failure. Number three, there could be the drugs that may have been used may be the one that the disease entities may have resisted. Okay, so just like we have resistant malaria, we also have resistant typhoid in some situations, and that is why the treatment, the drugs keep changing as a result of ongoing research and everything. Okay, but we'll still come back to that. Now, going back to where we left off your question.
You are talking about why is it that most times when we go for treatment, they will start the treatment while the blood is still in the
yes.
blood,
Now,
without even being sure that this is the particular thing.
Yes. It's not, if you use the word not being sure, like I said, we have provisional diagnosis.
Okay,
so a doctor makes a diagnosis on the basis of the clinical presentation.
Okay.
okay, just opposed with his clinical findings in such a patient. Okay. Now, if you want to wait till the investigation results are out before you initiate treatment, you may lose the patient. Nobody does that. Okay, what you can do is to take the samples that you need to do, investigations you want to do, take the blood samples, take the urine, take the stool, send to the lab. You initiate your treatment based on what your on your clinical judgment. And I said that usually I said that usually in typhoid, second week you have hyperpyresia, very high fever, usually associated with what we refer to as the so-called relative bradycardia. The fever is high. Anybody with high temperature expectedly should have high heart. The heartbeat will be higher than normal. The pulse rate will be higher than normal. But usually in typhoid, you have this relative bradycardia. There's high temperature, very high temperature, and yet the person's pulse is normal. Below the normal limit.
But doctor, is it possible for you not to run temperature? Because I've been diagnosed of typhoid countless times and I didn't run temperature.
Wow. Sure. Yes. Sure. We've mentioned that before. It's possible for
why temperature is my own symptom.
Yeah, I don't run temperature.
There's usually this
headache. I know you asked. Yes, at the back of your head.
Yes. Yeah. The two most prominent symptoms in typhoid are prolonged fever as well as severe headache. Okay. The other symptoms are there, but these are the most significant symptoms. And I did say at the beginning that oftentimes it could show no symptom. One could just have early flu-like symptoms and then it stops. And in such people, they could end up becoming carriers. When one is a carrier, the person may not be manifesting the signs and symptoms of the infection. The person may not come down with the disease, but the person has the capacity to shed the bacteria whenever the person passes stools, and oftentimes urine. Okay, so that brings us to...
Sorry, sir, before we go, Mr. Matthew asked a question, and I'm actually trying to get something right. Relapse is what we hear more often when we talk about treatment and the thing can't come back. Now, speaking of relapse, sir, medically, we are meant to believe that relapse, when it comes, it always serious, past the usual. I don't treat myself finish.
I don't have to.
Why relapse go come? What are the
it doesn't finish? Because there's a mindset in Nigeria that you don't like typhoid does not come to an end. Like when you have to keep treating, is that you treat every 3 months and all of that. Like can't you just kill it?
Sorry to interrupt you. Let's take Christian from Mina.
Christian, good morning.
Christian.
Yeah, good morning.
Good morning, Mr. Christian.
I am doing very fine. I want to ask the doctor a question. Good morning, doctor.
Good morning, sir.
Yes, sir. Please, you made mention that typhoid can affect heart muscle and also affect the kidney. So I want to know whether typhoid can be a factor that contributes to one's high blood pressure times.
Is it related to high blood pressure, sir?
Thank you, sir.
Thank you very much, sir. Now, usually, there's no direct relation with complications that could arise from typhoid to high blood pressure. But generally, when one is sick, the system is under stress. Okay, so that can actually aggravate any disease, any pre-morbid or pre-existing disease condition such person may have. Okay. For instance, take something like hypertension. When we undergo physical trauma, okay, it can actually push up our BP in someone who already has the BP. So sometimes some disease condition can help to aggravate some of the symptoms we may see. But in terms of a direct link to hypertension, I don't think I have anything like that.
Okay. We are talking about relapse.
Yes.
What are the...
Yes, relapse, because quickly I want to still go back to the diagnosis, but I'll take the question, sir. Now, relapse could be as a result of a number of factors. Oftentimes, it could be because the patient did not complete the
dosage,
the prescribed medications, the dosage. Because what we have in this environment, several areas, not just in this environment, when we commence treatment, is so with humans, and we have some relief of symptoms. What we do is that...
You stop taking your drugs?
Yes, on our own we stop. They will just talk the drugs away and think it is over. Okay, but typhoid is one disease entity where you need to actually finish up your prescribed drugs. Okay, now, the standard way to do the treatment. Okay, the ideal way to do the treatment of typhoid is that the person is placed on antibiotics. In this environment, we think that antibiotics therapy for a period of 10 to 14 days will be ideal. Okay, but in some other places, some other parts of the world, you'll be put on antibiotics and you'll be continually monitored. Okay, your stools will be taken on weekly basis for culture. You continue the antibiotics until you start getting negative stool culture.
Okay.
That should be the standard, mode of treatment, and not just the wider stuff. Okay. Also, people who handle food in restaurant, in
fruits on the road, fruit mongers.
No, vendors, fruit vendors, and I'm coming to that. But people who handle food, especially in dormitories and restaurants, okay, who feed large group of people, they need to do what is referred to as food handlers test. Is important. Anybody that has typhoid is not supposed to be handling food in such environment. Okay, in developed countries of the world, of course, typhoid is no longer as common in their places as it is in our environment. Once you're diagnosed with that, for instance, in the UK, it's actually a disease that you can actually report. If you have anybody with typhoid, you should report to the local authorities. They have to follow up on the person to ensure that the person is properly treated so that the person will not become a source that will transmit the infection to all other people in the society, in the environment. Because one of the things that keep the typhoid disease going, one of the things that fuels infection is urbanization. Okay, and because of the urbanization, typhoid usually is said to be more pronounced. Okay, it's said to be more pronounced in urban areas than rural areas. Okay, now I will tell you the reason. As a result of urbanization, there's increased activity, there's increased movement of people, there's increase in virtually everything. So the facilities appear to be overstretched in the sense that you will start having compromises in terms of sanitation and what have you. Another thing that makes typhoid to thrive is that it's a disease that thrives in areas where there is poor sanitation. Look at all the countries of the world where these diseases are said to be dominant. You can see that sanitation in those environments are not what ideally should be. Talking about places like India, okay, Pakistan, and even Nigeria.
Okay, Dr. Bat, let's hold you a bit here. So that we'll go on this short break. We shall be right back.
Yes, sir.
Go nowhere.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show where dey help people. Terms and conditions apply sha o.
For advert placement and sponsorship, make una call Stella Maris on top 070 3914 5229. Rebecca 070 6969 1950.
Okay, I was talking about some of the things that fuel the typhoid in our environment, and I said majorly is poor sanitation. Industrialized countries of the world have been able to make a lot of improvement in their water treatment, in their sewage disposal system, unlike what we have in developing countries of the world. And as a result, they've been able to reduce significantly the prevalence of typhoid fever in the environment. And who says we cannot do that in Nigeria?
Yeah.
Who says we cannot do that in African sub-region if we put our hearts, okay,
Doctor,
to
but
it?
do we have proper awareness? Because I know say now they set days aside for different things. Day for HIV, day for cancer, day for this, day for that.
Do we
But
have
I
a
know
day?
yes. Is there a particular day where we,
for
create
typhoid.
awareness on typhoid fever?
Thank you for that very important question. There's actually no day mapped out for typhoid fever, so to say. But that is why we are trying to create the awareness, the health education, so that people can at least know a thing or two on the presentation, as well as how to go about it. Okay? Okay, so before the question started coming, we were talking about diagnosis.
Yeah.
We're not done with the diagnosis. Okay, so I want to still go back. So I talked about the gold standard for diagnosis, which I said is bone marrow culture, which of course could take some days and is an invasive procedure. Next to it is blood. Okay, depending, if you're getting the patient, if patient is presenting before you in the first week, you need to take the blood for culture. Okay. After that, you have stool. You can do a stool culture if it is within the second or the third week, and you can equally do the urine culture. Now, when you do all this culture, you will be able to isolate the organism. Okay. Now, wider that we usually do in this environment, what fuels the mindset is, number one, it is cheap, it's affordable. Okay, so everybody can afford to do that. Another one is that usually, before now, the awareness, okay, on the sensitivity of the wider test is actually not where it should be. Okay, so as healthcare professionals, we need to take part of the blame, because it's our duty to educate the public. Okay, but what we have seen in time past is that a lot of people have spoken against it, have tried to do write-ups on the pages of newspaper that the way we regard the wider test is actually not what it should be. Okay, but oftentimes you discover that in reality, a patient walks into your hospital, is already having a result of wider on his hand. If he gives you the result and is telling you, doctor, I have typhoid, and this is what I've been having all my life. If you refuse to treat such a patient, I can assure you that you may end up losing the patient. Okay, if you're trying to correct the person that your basis of diagnosis of this typhoid is wrong. What are your presentation? If after, with all your lecture that you may end up doing at the end of the day, if you don't treat that person for typhoid,
losing him to another clinic.
You might lose the person to another, and another doctor will
just take it,
of course, and do a kill out of it. Okay, so but it's high time we started educating the public that if your diagnosis of typhoid is based on wider alone, you may be wrong. Okay.
Speaking of educating the public, sir, the issue of say wider and the one which if I actually hear you well, the one where you talk, say if person if you do the bone marrow one way they expensive, the gold standard. I think the next in line is the blood. Now blood culture. Many times when I get my typhoid, I observe say to do blood culture self. Nobody say it did that expensive because. You know, so vis-a-vis the wider, I want you to help us throw more light so that viewers at home, if we want to remove them from the shackles of wider, let us give them reasons to know that the blood culture is also very safe and is more effective. I think in terms of price range now, they are not far.
Yes, thank you very much. In terms of the price, and I must be honest with you, I actually don't have an idea. I should have made that finding. Okay, but I can tell you that a number of labs in our environment are equipped to do this blood culture. Okay, but because the demands are usually not there, that is why we seldom. That is why we don't see it plenty of times.
Just asking, sir, in your own hospital, the blood culture goes for us.
I don't have an idea.
You have a lab?
No, we have an in-house lab though, but I don't have an idea of. But I have an idea of the price range, but not a specific. Okay. It should range between 2,500 to
which is very affordable.
That's what I'm saying. I just
about 5,000, but I don't know the exact price.
And for the wider too, I can, because me I don't do am too. Make I no lie. For the wider too, because before
but wider is as cheap as 500 to 1,000.
No.
Maybe it's because of the price.
Wider now is about 1,015.
Yeah.
You understand, sir? So if original is 2,500.
And then the
one you are even advising us against is 1,500. I think we should check ourselves.
Yes. Now the reason. Now I need to give the reasons why the wider test is no longer reliable.
Good.
Okay, as we previously thought it to be. Number one is that you could have cross reactivity with other disease entities. Top on the list is malaria. So that means that somebody who has malaria can actually have a wider positive result. So in medicine we say that wider test is not pathognomonic of typhoid fever. What that means is not specific for typhoid fever. Okay, another reason is that just doing a single wider test, walking in and doing a single wider test, okay, can actually not be relied upon. Okay, now it depends. Whatever you're doing, even in some situations, if you have the wider test, you need to correlate clinically. You need to match the results you're getting with the presentation you have in the patient. If someone, for instance, comes into your clinic and has a very high-grade fever and has been complaining of headache and is telling you that this thing has been on for several days and is getting to 1 week, and if you have a wider result before you, whether brought by the patient or from any other place, you can look at it. Okay. One of the other drawback is interpretation. Okay. Usually, what we do in this environment is when people see that test result with usually
What is your math? You guys write it in the way that we don't understand.
Writing.
Usually
we
no, it's not even, there's no grammar in it.
I said diagrammatical.
They don't put even diagram. What you see is 1/40, 1/80.
That's what I'm saying. Now,
once anybody sees red pen on it, anybody sees red pen on it, I don't even understand why the red pen should be there in the first instance. But once people see the red pen there, and you're telling them that I don't think you have typhoid, we need to do this. Doctor, you want to wait.
It is red biro, yeah.
Red biro means you fail that course. So.
And oftentimes, the person who may have conducted the test for them may have told them that they have typhoid. So by the time they're getting to the clinician's office, the doctor's office, they are biased already. So whatever you say along that line,
so it is not just the patients now, doctor. Okay, I think it has to do everybody.
Yes, that is why this education is important. However, if somebody is presenting with symptoms and have an active disease, and as a doctor you have a wider test, if it is what you can lay hands on in your environment, if you have a 4-fold increment, say from 1/40 over 1/640, okay, that could be diagnostic. Okay, but leaving the patient and waiting for lab results before you can commence treatment is actually not allowed, because it shouldn't be done, because you can actually lose the patient. Okay, we talked about the complications that could happen: typhoid psychosis, myocarditis, and what have you. Okay, but having established the diagnosis, how is the treatment done? Okay, before we go to prevention.
Because that is where we are going to start next week. Yes, next week, because we don't really have the luxury of time again. I believe you guys at home really enjoyed the show because it's an educative one.
Yeah,
and also interactive, because we always give room, say, make una call in. We will be saying a special thank you to our host doctor, Dr. Bat.
Thank you very much.
Dr. Bat, you don't have a choice. You have to continue next week. As you start from the hair.
Start from treatment.
Like you don't know, say, na very big disease for Nigeria, so we can't just run
so
away.
we are starting from treatment and prevention. From our own side here, we'll say thank you very much.
I'll see you guys
next week.
1 to 2 on top 5.